Come in.
Hi, I'm Sherry and I'm your medical assistant today. Dr. Burt has asked me to give you a PPD skin test. Is that okay?
Yes.
Alrighty. Can you please verify your name and date of birth?
It's Beverly Heinley, January 10th, 56.
Alrighty, very good. Do you have any allergies?
No.
No. Alrighty. Have you ever had a PPD skin test before?
No.
Alrighty. What we're going to do is it's an intradermal injection, and this is not a medication, it's not a vaccination. This is an actual test to test for the bacteria for tuberculosis. What we will do is we'll clean the area of your arm, and I will place the needle just underneath the surface of the skin, and it will create a small wheal or a raised spot, a bubble per se. Is that okay?
Yes.
Alrighty. Do you have any questions right now?
Will it hurt?
It will hurt a little bit, and to be quite honest with you, patients will always say this probably hurts worse than getting an immunization done because it's just underneath the surface of the skin, and we're making your skin bubble up. Okay, so we'll get started if that's okay.
Okay.
Alrighty. So before we ever drew up our medications, we always want to make sure that we do 3 checks for our medications or whatever our order is. So we compare our order to our vial, and I did that as my first check before I drew up my medication, which we previously demonstrated. So this is my second check. I've talked to my patient and she does not have any allergies. So I do want to go ahead and get gloves on and prep her arm. Which arm would you prefer?
You can use this one.
Alrighty, so we're just going to roll your arm up. When we do a TB or a PPD skin test, we are wanting to use this section of the arm. We want to look for the skin. Is it viable? Making sure there's no tears or cuts in the skin. We want to also look at the arm for veins and make sure that there's no veins going to be in the way of us going just underneath the surface of the skin. I can look at her arm and I see that she has a V through here. So I'm actually going to cleanse the area right in the middle here, so that'll give me a good surface. And I do this in a concentric circle, which means I start in the middle and I work myself out to about 2 inches. While that is drying, I will go ahead and put my gloves on. And I will perform my third check. It is a TB, and I have my proper vial. That is what I've drawn up. I always want to make sure that my safety device is out of the way, and I'll see that once I pull my cap off. Okay. I will look, and where is the bevel of my needle, or also the lumen, which is the hole in the needle. I want to make sure that my needle does not have any burrs on there, because we don't want it to be like a fish hook trying to pull it out of the skin. So I'm going to rotate my safety device a little bit so it stays out of my way, and when you do, you make sure that you grab the base. You do not want to touch the needle. For this technique, we want to make sure that we hold the skin taut, which means we want to hold it tight. So I'm going to take my thumb on one side and my hand on the other and hold tight. As you can see, that pulls the skin. And just underneath the surface of the skin, I'm going to little poke here. What happens is I usually can see the bevel of the needle just underneath the surface of the skin. If I slowly release the skin, I can come around and inject the medication, the test. As you see, her skin is getting a wheal. Okay. And then we remove the same angle that we put it in. Activate the safety device. And then we'll place this into the sharps container. If we look at her arm, there is a little blood spot there that we can see. So I will give my patient instruction at this time. We do not want to press or rub on that because we don't want to expel any of the solution that we just injected. If you bleed, all I want you to do is just a light brush, okay? But we don't press or rub or put any bandages on there. Is that okay?
That's fine.
Alrighty. So before you go, I want to make sure that I measure. And this is my wheel ruler. Okay? And I want to measure the size of the wheel. So I'm going from the outside parameters of the wheel that I've created. And I have a very nice 9mm wheel. 9 millimeters, if you look at the ruler, is that little line right before the 10. Okay, alrighty. We can roll your sleeve down. I will complete your form for you. Now, you're going to need to come back. That is 4:03 at this point in time. So what we'll need for you to do is come back on Wednesday after 4:15 or on Thursday by 3 o'clock, just in case we're very busy and it takes us a little bit of time. Will you be able to make that schedule?
Sure, I can come back on
Alrighty,
Wednesday.
very good. I will keep your sheet at my desk, and therefore we can result that when you come back.
Okay.
In today's medical office, we a lot of the times will use electronic medical records, so we would document within the medical record. But part of the requirements for our program is we have to document on paper and in an electronic medical record. So that's why we will document in two places. We will document on her results sheet, is what she could provide to her employer if that is what she was getting this for employment purposes. We would also document within the patient's paper medical record. You'll be able to find an example of the documentation under documentation samples in D2L.